Hi, this is Dr. Steflik with Coastal Integrative Healthcare in Edgewater, Florida. We've got our patient here we're going to demonstrate on today. His name is Brian. Say hi, Brian. Good. So we're going to demonstrate today a specialized treatment we do for herniated discs. This is particularly useful when there are patients that have symptoms traveling down the leg, down the back leg, down the front leg, wherever that nerve is being pinched. We've had extremely, amazingly great success with it on those type of patients, usually after 3 to 5 treatments. It's a fairly newer technology. Not a lot of doctors, other offices know about it, are aware of it, so that's why we're sharing today what decompression therapy is. So first thing, before we get started, we need an MRI because we need to know what level the patient is having problems. So Brian, where is your disc problem at?
L5S1.
L5S1. So now that we know L5S1, we can set the table specific to that setting and focus on that area for the treatment. What a disc herniation is when the disc extrudes or shoots out and can put pressure on the nerve. We're trying to reverse that effect by having the disc pull apart and create a negative vacuum where the disc will go back in. So to get started, we're going to have Brian lay on his back, face up here on the table. We're going to make sure that this bottom belt comes below his hip line because it's going to latch onto there. And we're going to strap him in down here first, as tight as we can get it. You all right?
Good.
Still breathe? Good. Slide up just a little bit for me up the table. Perfect, right there. It's good. This top one we're going to latch on here for his rib cage, under his rib cage. So we want that up under here, this up under here. This strap is for the hook, so when we hook him onto the table, that's where it's going to be pulling from, so it needs to be fairly tight. Good. Once we get up here, we're going to hook him up to the table. And make sure that the tension is all out. Now the next thing we need to do is set it to the right angle to make sure that we're targeting the right disc. So for him, L5S1, which is a very common area to have disc herniations, we can see which level that's at by adjusting the angle where it's pulling at. All of our lumbar vertebrae are at a different angle. So if we can adjust the angle that it's pulling at, we'll be able to target on that disc. So for him, we would want to move the table up. He's going to be up pretty high. So we're at 10 degrees right there, still pulling up. Make sure the tension's all the way out. And right there is L5. Good. Now, we need to get the settings on the machine here correct. So turn it on. These settings, I'm not going to go through all of them. Basically, once we know the patient's weight and how much time we want them on the table for, we can customize them for each individual patient. I'm just going to put in some for Brian here. There we go. So right now we have a max pull of 70 pounds, minimum pull of 50 pounds. It's going to go through 3 cycles of pulling and relaxing. That helps the disc and get the fluid into the disc, get the nutrients into the disc that it really needs. I'll turn it on just so you can see kind of what it does here. There we go. So he might slide a little bit as it adjusts here. It's going to pull right down the middle. This top part is hooked into the table, so it's going to keep his top part from sliding down. And it's going to start pulling on that disc right at that exact angle. The really cool thing about this table is we can do it in a supine position, which means on your back. We can also do it with somebody face down, or we can even do it on their side. So if somebody can't lay face up on their back, we can have them do it face down, we can have them do it on their side, any position that we need to. So Brian's probably just barely feeling it pull there just a little bit.
Yeah.
Got a pretty light setting there. and it would run for several more minutes. It's starting to ramp up here again to the next level, pulling them a little bit more. And that's about a 15-minute treatment. When we're done with this, we ice, we can do some more adjustments, and yeah, make the patient start feeling better. Like I said, typically about 3 treatments, and we start to should notice some very positive results, up to about 12 to 15 treatments. So this is our decompression table. If you have any questions regarding it, please call our office, 386-427-8403. Check it out on our website, coastalintegrativehealthcare.com, or stop in and ask us questions. We're right here in Edgewater, and we're the only office in Edgewater that has a decompression table. And yeah, we're happy to help, here to serve. So like it, share it with someone you know that could benefit from this, and we'll see you soon. Thanks.